Hello everyone, I am Lance Wilkerson and I am with recreational therapist Jessica Putney, and today we're going to talk about mental health because one of the unintended consequences of COVID-19 and coronavirus are people's mental health as they're in quarantine or sheltered or having to work from home. So that's our topic today, and let's just dive into your number one piece of advice for people that are going through that right now.
The number one piece of advice I would give is make sure you try to stay active. I know it seems hard to do that. It's easy when you're at home, just kind of want to veg out on the couch, but it's important that you stay active and still make sure you're doing things, and especially want to make sure you're still getting regular exercise. Exercise has been shown to be one of the most effective ways to help decrease anxiety and depression, which we have a lot of right now at this particular time. And there's a lot of ways you can do that without going to the gym. I mean, you can still go outside and walk or jog or ride bikes as long as you stay, 6 feet away from everybody. You still got to do your social distancing.
And we did do our social distancing, which we heavily encourage, and stay home, don't get out, as we do our best to flatten the curve so far. And also, at least inside, if you like to do something, is it okay just to do it more, whether it's gardening or something like that, and just do it more often?
Absolutely. This is the perfect time to spend more time doing the hobbies and leisure activities, particularly if they're not things you get to do normally. So you can do more of them, or you can maybe do some new hobbies that you haven't tried before. And there's a lot of things, or you can just do them differently. One example is a lot of people love scrapbooking. And scrapbooking, though, usually you buy these big kits, and those are really nice, but we can't get to the store right now to buy the big kits. So you can do scrapbooking kind of the old-fashioned way, where you use things from around your house. Like you can cut out letters from soup can labels, you can cut out pictures from magazines. Lots of things to make a scrapbook and really make it, in a lot of ways, a really unique scrapbook, because you have to get really creative with it.
And if there's ever a time to record history, now would be the time. That's scrapbook
true.
20 years from now would be pretty interesting.
That's absolutely.
To say the least. And I know there's other new things that you can do with your family as well, and you even brought a little prop.
I did. You can do things with the kids. Like one of the things you can do is you can make homemade instruments. I made just things I found around in my house. This is a water bottle. I just took the label off of it, colored it with a marker, and you can fill it with rice, beans, anything you have, and make a homemade maraca.
Let's hear it. I like it. I think that's a good idea to do things with family. I also think, and actually Dr. James Porter and I, we joked about this, is Parker Brothers and Milton Bradley are probably making a big comeback because people are dusting off the board games. I would imagine that's a good way to kind of keep things interesting.
Yeah, with board games, again, you're going to get your mind off of your worries. I know everybody's got a lot of worries going on right now, so get your mind off of it, laugh, spend some good family time. It's a great way to boost your mood and just really make a nice evening.
Electronics. How much is too much? It's good that I can't imagine going through COVID-19 30 years ago. So there's a lot of positives, but you probably don't want to have your face buried in your iPad too long.
No, you want to really watch out for that, because research shows us that too much time staring at an electronic screen can actually increase anxiety. So you want to make sure you kind of set some limits. What I generally tell people is you want to keep electronic times to 2 hours or less at a time. That way, again, you can still enjoy your electronics. You're right, it's a great way to pass the time, especially when you're spending a lot of time in your house. But you also want to make sure you have time to do other things and keep active.
Also, it's important to stay social, right? You want to keep up with your family, keep up with your friends. They want to hear from you more.
Yes, you definitely want to keep up your social interactions. You may not be able to see people face to face, but you still want to call, talk, FaceTime. FaceTime is a good way to, again, still see people and still interact and still get that social interaction that you do need.
What if someone is clinically depressed or suffers from anxiety and is feeling it a little bit more? What advice would you have to them?
If you are experiencing depression or anxiety, if this is a chronic problem or if this is a new problem, I recommend you want to ask for help. There are a lot of resources out there. There is the National Suicide Hotline, which is 1-800-273-TALK. It's 1-800-273-8255. Our care team here at Deaconess Cross Pointe is 1-800-947-6789. Or you can always call your local 911 or go to your closest ER.
And those phone numbers are 24 hours?
Those are 24 hours a day. And if you have depression or anxiety get severe, especially if you're having any suicidal thoughts, you want to get help as soon as possible.
Thanks so much, Jessica. So much great information. And if you want more information, you can go to the website here at Cross Pointe. It's deaconess.com/crosspointe. There's a lot of resources there that you can look into as well. For Jessica, I'm Lance Wilkerson. Stay safe, practice social distancing, stay home when you can, and have a great rest of your day.